are there lots of people? Okay, let's get started. Thanks to my committee, we have a big I'm not begging for people to make it, and that's really because everybody's busy as we come to these last days. Well, I didn't say which way these bills needed to go, but the senator's not here, or our other House member's not here to present the bill, so I am going to start with my bill. And I'm just going to work it on myself. Well, when we get to voting, we're not going to vote right at the moment. Okay, I bring to you the substitute to House Bill 872. Does everybody have LC 3398287? Yes. I think if you can take a minute.
8S, 8S, right?
8S. Sorry, did I say A?
7. 7.
Okay, I don't know why I did that, but thank you very much. Okay, I have been very careful to define what conception means. You need the coffee? And conception means the process of combining the male sperm with the female ovum, and that results in a fertilized ovum or a zygote. That is the technical terms that's straight out of the medical books. When the two combine, that is the definition for conception. And a contraceptive or contraception means a method of inhibiting a development of a human pregnancy at any stage prior to conception. That means before the egg and the sperm join together. A contraceptive would be anything that inhibits those two joining together. Pretty simple. And it's including, but not limited to, the administration of emergency birth controls subsequent to sexual intercourse, which delays, prevents the release of an egg from the ovaries, but does not end in a pregnancy. And then that females have the right to use any means of contraception. And so the only question I've been really asked on this is about the morning after pill. So I'm going to tell you a little story, and it's about the morning after pill and how that really works. Okay, a man and a husband have intercourse, and the male ejaculates. And then all those little tadpoles, better known as sperm, start to work their way up through the vagina, up through the uterus, and then on into the fallopian tubes. And then there's a period when they're actually out of the fallopian tubes and not in the ovaries. They're just sort of floating out. But what happens, they're sort of slow swimmers. And they don't go really fast all that way on that long journey. They just sort of slowly make their way up. And so when a woman takes a morning after pill, that morning pill goes, danger, 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 to the ovary. Wait a minute.
Can I ask a question? Because you said in your introduction there it was a man and a husband.
Well, I didn't mean that. It's a man and a woman.
Oh, okay.
Now,
I get it.
when's
but
the last time you interrupted a storyteller? Do I have to start all over with my story? How a sperm makes its way and gets there?
No, absolutely not.
Okay. When a man and a woman have intercourse, and the man ejaculates into the vagina, those little sperm start their way up, better known as sometimes tadpoles, make their way up through the vagina, into the uterus, and on up toward the fallopian tubes. And they're slow swimmers. Everybody got that? They're slow swimmers. And so when the woman takes the morning after pill, it sends out danger, danger, danger signals to the ovary, and it tells the ovaries not to release an egg. So there is no joining of the egg and the sperm. So the morning after pill is a contraceptive that prints, and that's how the story goes about it. So I thought I would explain that, but I'll be glad to answer questions about the bill. And guys, you can speak up if you want to. I'll answer your question.
Any questions? Do we have?
That's okay. Come on, that's going over. Or you can use your mic. Okay. Can you see it from there? He can see it.
All right. Number 18 is Mr. Reese. Yes, sir.
Yeah, Madam Chair, I know I came in a little late, but can you just, if you don't mind, touch on or reiterate where the stork fits into all of this and how it brings the baby?
Well, I guess, this reminds me of when I was a freshman and presenting my first bill, and it was on stalking. And one of the Democrat reps, who was a farmer, asked me how my bill would help him. And of course, I said, well, I guess it depended on what the cows were following him for, whether they were just going back to the barn to be milked or whether they were trying to do him harm. To answer your fun question, I guess it would be when the sperm might leave the fallopian tubes and they're just floating out there and they're not in the fallopian tubes and they haven't been fertilized or anything, maybe the stork comes in and saves them then. It sounds like a good answer for you. Okay, what do we got? Ken.
No.
Here we go.
Number 5, Representative Cannon.
Thank you. So when I saw this bill drop, I was really curious about what we're trying to do here and took some time to speak to some medical professionals. And I'm just concerned that we're putting the language of conception and contraception into the code at all. So I'm just wondering if we're open to not adding that to the code and therefore just having only this bill be line 18, which I do think needs a little bit of edit too, because males also have the right to use any means of contraception, barrier method or vasectomy. And so I'm wondering if we can at least add males into this. And then after that, maybe consider removing the descriptive language. Thank you.
I am sure that there are other places in the code, Kate? There are that already talk about conception and contraception, so they're already in our code. And if you want to bring a bill like that covers male, bring it and we'll see where it goes. So, I'm sorry, I may take over.
Yes. Number 23, Representative Olson.
Thank you, Madam Chair. Can you tell us what the bill actually does?
It just puts into Georgia code that women have the right to use any kind of contraception that they want to use. Okay? I mean, we assume things, and there's a saying about assume, makes an ass out of you and one out of me. And so we are just not assuming anymore. We're putting into code that women in Georgia have the right to contraceptives. Yeah. Simple. Okay.
Number 4, Representative Barnes.
Thank you. So are we saying that the men in Georgia don't have those same rights?
No, this is about, we're going on the female basis right there.
Well,
I-
okay.
And it's late in the day to start adding things.
But we're already in the code. And,
I-
mean, can I have the mic or no?
No. Tell you what, we're having a hearing today. I don't know where this will go after the hearing. We may have another meeting, who knows? But I will go and ask about that with you, and if you'll talk to me about it, I will go and ask Legislative Council rather than trying to add something in now.
I have a question
Sure.
for you. On the morning after, or is that just I know the title is morning after.
That's what they
but
call it.
If is that work if any later than that, or the 2 days after, or 2 mornings after, or a week after, or what?
Well,
I don't know.
No. That women are encouraged to use it as soon as they can afterwards. It really says up to 3 to 5 days. But, when it's ordered, the doctor ordering will tell them it would be a whole lot better to take it as soon as possible and not to go that 3 to 5 days. I mean, medication, all medication has some kind of when it's activated in your system. Okay, Representative Al.
Representative.
Clarify about the emergency contraception, which is Plan B, or the morning after pill, as sometimes people call it. Sometimes people will confuse it with other types of medication,
Right.
but emergency contraception, Plan B, the morning after pill, prevents ovulation. It prevents pregnancy. So that's the difference, and I think that's what we're asking is the window of time that's recommended to take it is obviously as early as possible because you want to prevent something from happening.
And as I always try to do, I try to be as well prepared as I can, and that fits the definitions from Mayo Clinic. Okay.
Representative Hilton.
Thank you, Mr. Chairman. I just want to thank the author of this bill and all the sponsors, frankly, who signed on. I want those who are listening at home just to appreciate what we've done for women's health care just this very session with the codifying of IVF, and this is yet another step in that right direction. And so thank you, Chair Lady. At the appropriate time, I'd like to make a motion to do pass.
I believe this is
Hearing only?
just a hearing.
Just
I'd
a
still like to
hearing?
pass it,
I'm
but
not sure.
hearing only is fine, too.
Okay.
All right. Representative Howard, number 3.
Thank you, Mr. Co-Chair. A simple question: do women already have these rights, or are we just adding to what they already have or don't have?
Representative Howard, I don't know what you heard, and as I said, when you assume something, it can make an ass out of you and an ass out of me.
I heard that before.
And I think women have assumed that we had that right. We have all these rights, but this is just codifying it into code. Legal rights in the state of Georgia. It's only Georgia. And I will tell you the contraceptives, and the reason, we talked about everything else, but we haven't talked about contraceptives. And it's like I told the press, contraceptives play a part all through, or they can play a part through a women's life cycle. I mean, a lot of young women, when they get to be teenagers, will have terrible acne, or they will have terrible pain with their menstrual cycles. And one of the ways that doctors take care of that is to put them on birth control pill. Sometimes for a little bit of a period of time, a few months, sometimes they have to stay on them because the pain is so bad. In family planning, I got corrected the other day. Used to be, we have trouble with people having low-weight birth babies and having trouble getting healthy babies. And one of the things is women do better. I used to say and I'm staying corrected, when they put about 3 years between pregnancies. Pregnancy is stress on the body. It uses up a lot of our vitamins and minerals as a mother, and physicians feel that they will get better, healthier babies with less stress on a mother if there is spacing between times. So they play a different role at different periods in our life, and so I just decided it was time for us to look at them and codify them. Do you have people that want to comment?
Number 5, Representative Cannon.
Thank you. So, in this bill, I guess, what happens if a man wants someone to take contraception, but maybe they don't want to? And then what are the teeth of if someone is not allowed to take the contraception that they want?
There's nothing in this bill, but I think that would be between the man and the woman, and I would think women are pretty resourceful these days, that hopefully that they would find a way to get birth control pills for themselves and not be real obvious about taking them, and I really don't know. This bill is just codifying the law that we have the right to have them. Bills don't take care of every problem in every single bill. You have to start somewhere, and that's where we're starting with this bill.
Okay, I think we have a couple of people that would like to speak about this bill. Kate Buena.
Hi, everyone. Thank you for having me. I am Kate Boyanga. I'm the Executive Director of the Georgia OBGYN Society. I'm here today to support this bill. Access to contraception is one of our legislative priorities, and we look forward to working with the sponsor of this bill in the future.
Any question? Okay, thank you.
Thank you.
Okay, Christina Chi.
Hi, I'm Christina Cheek. I'm the founding executive director of Sister Girl Birth Initiative in Valdosta, Georgia. As a community-based doula and perinatal...
Who are you with?
I'm sorry, I'm Christina Cheek. I'm the founding executive director of Sister Girl Birth Initiative in Valdosta, Georgia.
Okay.
As a community-based perinatal health educator, I have seen the ugly side of things when women and men don't have access to contraceptive and family planning. So I just want to make sure that it is imperative that you properly research and consider all angles when drafting this bill, because right now the maternal state in our state, the status in our state needs improvement. And it is under direct attack right now. So I just ask that you and the committee members just consider all angles before you support or go forward with this bill. Thank you.
Thank you. Number 4, Representative Barnes.
Can I ask you a question?
Yes.
Can you come back?
I'm sorry.
You said the current state. Can you tell us where we are with maternal mortality in the state of Georgia, please?
I will be glad to. Right now, we rank 45th in the nation. Right now, the most recent March of Dimes report, we're 45th in the nation regarding maternal and infant health. We have a 32.1% maternal mortality rate. 7.1% of our babies are born low birth weight and premature. That is not okay. It is especially worse in rural areas where I live, where we often face hospital closures. We have lack of access to care because of transportation barriers, and unfortunately, a lot of practitioners don't want to come to rural health areas because of the poor workforce incentives. So that's where community-based organizations in education and access to options come in to improving maternal and infant health rates.
Thank you for that information. But you would acknowledge the fact that Georgia we base our maternal mortality rates for a whole year. and many states only go out for 42 days. And so there is a big difference in the apple. And I hope you would acknowledge that over the last few years, we have put a huge amount of money by extending the care of our mothers for a year. I got $20 million for that. And that we have been around the state with our hospitals pushing the bundles, which are not really bundles, but they are teaching people in the hospitals where they have a lot of babies and have staff for it, how to be ready for hemorrhaging, because that's one of the major things that we have, that where we can lose a mother. And I know that we've been working trying to get and one of my committee members has tried to get the medication that they have now approved in England over that will predict whether you might be a candidate for eclampsia. So I'm just protective of our state. We've done a lot of work to improve. We got ways to improve, but you know, sometimes when we hear where we are, it doesn't paint the picture of how hard we are trying.
So let me just, could I just add, there have been improvements to solve the maternal infant health crisis, but I will tell you, every day, boots on the ground, where I am a person that goes directly into the home, I get to see these women and men outside of the hospital when they go home and when they're sitting there at 3 a.m. undergoing a crisis that could have been caught. You know, a lot of we're pushing a lot of money to this, but sometimes we're missing the mark in a lot of different areas. So again, I think community-based organizations are critical, and then access to funding for community-based organizations.
And I agree with you, and I know public health has started a home healthcare place where they're actually going into the homes and sending people in. And there's a lot of work to be done in a lot of areas, and I appreciate you working in this area. Like I say, I'm just proud of my state. I've been here a long time, and I've seen where we were, and I've seen where we've come, and I'm thankful for that and for the people who have supported our efforts to put more money, more time, more energy into that. So I thank you very much for the group you work with and for you doing that. And there's a lot of work, and there's a lot of us here, both Dems and Republicans, who are behind trying to help you. So thank you very
Representative
much.
Cannon, did you have a question?
For the OB Society.
Okay.
But I just wanted to see if y'all supported this bill as it is today, or were you saying not as it is today? I'm just not clear.
We haven't had sufficient time to review the bill, but it is the bill we are very in support of.
So you haven't seen the bill, but you're speaking in support of it, and I'm asking you a specific question.
There's revisions that we would most likely make if it were to move forward. We look forward to working on those.
Okay.
Representative Cannon, that's one of the reasons that we are not taking a vote right now. And I said that we might meet later, but that is one of the reasons that we're not taking a vote. Let's just move on.
All right. With that, we're going to close the hearing, and we'll move to the next item.
Thank you. Okay. All right. Let's go to, where we put it down here, Senate Bill 185. And Senator Robertson, you have the floor.
Sorry, did you say 185? No, ma'am, I was queued up on 101. I was just looking at the calendar my admin had given me, but I've got it.
It's my understanding that Representative Clark stripped that bill.
He did, and came over and spoke with me because we got appropriations to take care of the Duchenne's muscular dystrophy. And we had a House bill come through insurance on our side. It's a very good bill, and it passed out unanimously from the House bill dealing with prosthetics, and I think that language was placed in there is what I was told.
Wait a minute. Can you got it? Let's see. Because it was supposed to, it was my understanding that he stripped it out.
No, ma'am, you're correct.
Okay,
Yes, ma'am.
that it's all out of this.
Do you have both? Does he have two bills?
No, it's,
I mean, it has his name on it because, okay,
It's-
Representative Clark
right.
told me that he would be presenting 101, and that
He-
he had stripped the bill like we can do, totally out of it.
Right, he ran over to a hearing with Senator Tillery
Right.
and just told me if I came up to, had the opportunity to let you know that he's going to hurry back as fast as he can, but 101 was the first bill that was on the list that my admin got, and then the second one was 185. I just want to make sure.
No,
we were-
we're going with 185.
Yes,
And
ma'am.
he can come present the other bill when we
Very
have
good.
some other things to do. Okay, where's 185? Now I've got everybody looking for it.
Madam Chair, do we have the new language for 101?
The new language is in the 101 that you have.
Yeah,
It has to do with prosthesis.
correct.
Okay.
I got funding for that, so it's in appropriations. To the, yes, ma'am.
And he got funding for a pilot project
For a
in
pilot
public
project-
health.
For a pilot project on Duchesne Muscular Dystrophy. Yes, ma'am.
Okay,
Okay,
so you're up for
Yes, ma'am.
185. That's LC, let's make sure everybody's got the right one. LC 394625.
yes, ma'am, that's what
Okay,
I'm reading
we
off
got it.
of.
Okay,
Yes, ma'am. What Senate Bill 185 does is, while working with individuals downstairs, we work to basically, if an individual is incarcerated in the Georgia Department of Corrections, that we cannot use state funding to do any type of sex transition, sex reassignment surgeries. If a person comes in and they are already going through certain therapies related to gender dysphoria, we are not prohibited from continuing them on certain programs, no matter what that might be, as gender dysphoria is identified in the DSM-5 and the DSM-5-TR. And so anything dealing with depression, anything dealing with certain therapies associated with it, as long as those therapies are not, as you'll read in line 73, it said the board shall adopt rules and regulations regarding the procedures and therapies prohibited by this subsection, which shall provide for the following limited instances in which the treatment set forth in paragraph 1 of this subsection shall be authorized. Treatment for medical conditions where such treatments are considered medically necessary, provided that such condition is not gender dysphoria, or the purpose of such treatment is not for sex reassignment. Where that's the meat of the bill. This does not, if you see on line 79, treatments for individuals born with medically verifiable disorder of sex development, including individuals born with ambiguous genitalia or chromosomal abnormalities resulting in ambiguity regarding the individual's biological sex. Treatments for individuals with partial androgen insensitivity syndrome, and hormone replacement therapy treatment for state inmates who were being treated with such therapy prior to the effective date of this act, provided that the provision of such therapy is solely for the purpose of transitioning off such therapy. And that's the bill short.
okay. We have questions. Representative Barnes.
Thank you. Senator, you said if the depression is related to their transitioning, then that won't be treated?
No, ma'am. No, ma'am. I said things such as depression that sometimes are listed in the DSM-5 and DSM-5-TR related to that. Those types of things for depression and things like that will continue on.
Okay.
Yes, ma'am.
Thank you.
And as you know, there's several conditions that come along that can be associated with gender dysphoria that are more on the outsides, the depression and some of the other things. So we're not going to impact any of the treatment that is commonly associated with those conditions.
All right, thank you.
Thank you, Madam Chair. Mr. Senator, I just want to start by kind of understanding where do we get this idea with this bill? Do you have a reasoning behind this being a burden to our state, cost-wise? Have you looked at the lawsuits that our state has, lost on these? And are you aware that this language is in another bill that just was in a committee about 10 minutes ago?
I'm not aware of the language being in another bill that was in a committee, but yes, ma'am, I have looked at the lawsuits and read some of the correspondence with the courts. And one of our concerns, and we feel one of our weaknesses, is that we do not have a policy prohibiting this, and so this is where this would go, for the department to create those policies that do prohibit this type of surgery.
And so with that line of thinking, can you help me understand why this is not discrimination? And why can we decide these certain people, like this, from my view of it,
yes, ma'am,
my read of it, this would be the same as saying, oh, a Jewish person can't have this type of procedure. So help me understand how this is not discrimination based on someone's gender identity.
Yes, ma'am. I'm not really sure that I could marry up the fact that someone is Jewish to the fact that someone is going through a sexual transition surgery. Yes, ma'am. I can't quite marry that up. So I wouldn't be able to help you with that, no, ma'am.
I mean, can you still answer the question, how is this not discrimination? When you choose one group of people to allow something for, and then you say other people cannot have it, if that's an inequity there, I'm just asking, how is that not discrimination when you choose the people?
I think choosing the type of medical surgeries that you perform on somebody, not unless we were talking about life-threatening surgeries. I think if somebody came in to the Georgia Department of Corrections with a serious cardiac ailment, 2 individuals came in, and I think if one of those individuals were African American, the other individual were white, and you chose who to do the surgery on based on that, I think that would be discrimination. I think it's life-saving surgery that would be required. This right here, as identified in, like I said, in the DSM-5 and DSM-5-TR, do not fit into those categories. And basically, the individual would come in. There would be no attempt to prohibit the individual from going through whatever issues that they may have, but what it would do is prevent the state of Georgia from spending tax dollars on these individuals to do transition surgery.
May I have one follow-up question? And so are you aware that this is care that's supported by the American Academy of Pediatrics, the American Medical Association, the American Psychological Association, and almost every other leading U.S. medical professional association?
I've heard to some degree and read quite a bit that there are some that have some concerns that lean back more toward the mental health side as opposed to the actual physical health of the individual. Yes,
okay,
ma'am.
so you're aware. Okay.
Thank you, Madam Chair. Just a quick question, and it's on line, starts on line 61 and 62. Nothing in this code section shall prohibit the department from negotiating higher fees or rates with healthcare providers. Why would we just do higher? Why don't we negotiate lower?
That's language that was already in the bill, ma'am.
Okay.
Yes, ma'am.
Thank you.
Thank you, ma'am. And I agree with you. We should always go lower. Yes, ma'am.
Thank you, Madam Chair. Hi, Senator. How are you?
I'm well, ma'am. And you?
Good. Nice to see you again. I enjoy working with you, and we have a friendly relationship. But I have to ask you, we've had over 1,000 bills filed this year across both chambers. This is clearly a priority of yours. Why did you feel that this needed to be a priority for the state?
Well, and my thing is public safety is a priority of mine. And I just finished doing a study committee on the Georgia Department of Corrections. And a big part of that was spent looking at the cost dealing with health care in the Georgia Department of Corrections, whether we were talking about pharmacy, services provided to the inmate as they come in the door, and service provided to inmates who have been in the system for years. As I'm sure you know, we have senior care within the Georgia Department of Corrections. And I think for us to be wise with the tax dollar, that we have to look throughout the Georgia Department of Corrections, health care and everything else, to make sure we're using the money where it's most necessary. And I think these, and I understand individuals get upset when I say this, but I do mean it with all compassion. Elective surgeries cannot be a part of our cost in the Georgia Department of Corrections.
Can you share what cost this bill would save us?
Well, I can tell you right now that we have approximately 5 individuals who are seeking transition surgery at the cost of the Georgia Department of Corrections budget.
Can I ask one follow-up comment, please? You know, the reason I asked you why you ran this bill is I've heard this comment several times from colleagues in our chamber. You know, you should really vote for this bill because, you know, this issue about inmates and gender-affirming care is why Kamala lost the election. That comment's been made to me several times, and I just have to put on the record that I really resent a subset of our patient population being used in this way for clearly political reasons. And I really wish that you had not put your voice behind this bill.
Well,
Thank you, sir.
I greatly appreciate that. I think if you recall with the time we spent together in the Senate, politics is usually the furthest thing from any action I take. Everything I do is based on logic, based on numbers, and while it doesn't make me popular in this building, it does keep me consistent.
Okay. Representative Barnes.
Thank you, Chair Lady. Trying to see which question I want to ask. So if a person discontinues their treatment while incarcerated, are we going to provide mental health services to that individual?
Yes, ma'am. We already provide that. We do multiple RFPs on health. We do dental, mental, physical, and spend hundreds of millions of dollars. But the vast majority of our pharmaceuticals are dealing with psychotropic type medications and other medications to help individuals experiencing, whether it's things associated with what you're referring to, or whether it's somebody transitioning off other issues surrounding their life, whether that be substance abuse, the depression of actually being inside of the Department of Corrections, and things of that nature. Yes, ma'am.
Because we know the data states that the suicide rates are higher among these individuals. So I wanted to understand what type of mental health coverage we were going to increase if we were taking away this treatment. And then I also want to ask, say this individual wants to personally pay for this care. Is that an option for that individual?
No, ma'am. We normally don't allow individuals to pay for personal surgeries while they are while they're in the care of the state, because they are in the care of the state, and because we've had the same issue at times where somebody may have wanted a breast augmentation or something else from a self-esteem issue, and those weren't able to be done either.
Okay, and then one follow-up question.
Yes, ma'am.
What's the tab, or what's our fiscal note? I don't want to say fiscal note, but how much are trans in prisons costing the state to provoke this bill? I believe Dr. Al kind of asked this question, but I want to know, like, how much is this costing us to provoke this bill? And then if there are only 5 individuals that we're worried about, I think I want to understand how much those 5 individuals are costing us that provoke this bill.
Yes, ma'am. I think that's a fair question. And the we have the 5 individuals who are seeking the care, and then we have the lawsuits. And if you look at that, one of the failures within our system right now is the fact we do not have a policy against it. And what this does is establish that policy, ma'am.
Thank you for your answers.
Yes, ma'am. Thank you.
Okay, Representative Cannon, I'll give you the last question, unless somebody has a burning one after this one. Can I have one too? Oh, I'm sorry. Okay, we didn't pick that up. You'll have the last question.
So I thank you.
Oh, I'm sorry. Okay.
Mm-hmm. I thank you for your interest in reforming, GDC, really the things that have been happening in the correctional facilities in Georgia. We know there are documented human rights abuses, over 300 murders last year. And so I guess I'm trying to understand, what other measures are you pushing? Like, for example, today I was told, we're not working on that bill. If you want to drop a bill, go ahead and drop it, and, we can work on it. And many times we'll do that, and it will go nowhere. So what are some of the other evidence-based methods that you are using specifically to reduce the cost of procedures that transgender inmates are having? It seems this is very punitive, one-sided, saying you cannot have this thing. So what other methods are we adding to the toolbox?
Well, if you're talking about in the Georgia Department of Corrections overall, I mean, through appropriations and other things that came out in the course of the study committee, we're adding funding in to make the what we hope to be, to make the Georgia Department of Corrections a much safer place for everybody there, whether they be transgender or not, whether they be male or female. Specifically, this would be the one thing that would impact, I think, the question you're asking, because we're taking an all-hands-on-deck approach where we're looking at every aspect of the Georgia Department of Corrections, not just the health, not just the physical health, mental health, or dental health, but all of the health and the facilities and the other hundreds of millions of dollars we have to invest in there to solve the problem that you point out that I think has developed over time to where we need to come back and get the Georgia Department of Corrections back up to the standard that it needs to be.
Right. Well, the 300 murders were last year.
Yes, ma'am.
And so I guess we'll be seeing other legislation with other procedures that we are outlawing because they're so expensive that we don't actually have the number of how expensive it is. But you'll be bringing other initiatives too, I assume.
Well, I appreciate your assumption. I'm not sure that'll happen.
Okay, last question, and this for Representative Renner. Sorry I missed you earlier.
That's okay. I just pushed my button. Just a quick question, Senator. How many other states currently have passed this type of bill?
I know there are other states that currently have policies on the books, but I could not give you an accurate number without being concerned that I may give a wrong answer, and I wouldn't want to do that. But I'd be happy to look and see and reach back to you with that, ma'am.
Has there been like one state? Just one state?
No, passing particular legislation again, I can't tell you that because what this does is establish a policy. But I'd be happy to look into the policies of other states, whether it be in the Southeast or throughout the country. I'd be happy to find that information and provide it to you.
Thank you.
Yes, ma'am. Thank you.
Okay. We got? Okay. Oh, Representative Hilton.
Thank you, Madam Chair. The idea of politics was brought up, and politics does inform policy in as much as that politics reflect what our communities want. And I think, if anything, this last cycle, we learned that this was a 80-20 issue, not just in Georgia, but frankly, America, that folks were flabbergasted to learn that a small segment of our population supported policies like this, opposed policies like this. And so I thank you for bringing us this common sense legislation, and at the appropriate time, I'd like to make a motion to pass.
Second. Now we've already gone on. Wait just a minute, we'll let you. Okay, a motion and second. Further discussion. Representative Allen.
No, I was just going to thank Representative Hilton for coming forth and admitting he was one of the people who made that comment to me, but appreciate you self-identifying.
Okay. We have a motion and a second. Further discussion on it. Everybody in favor of the passage of Senate Bill 185, say aye.
Are we not taking testimony?
Testimony, please. Oh, I'm sorry. Thank you. Okay, we do have several people that want to talk about this, so let's start down. Emily Carlson.
May I proceed?
I move that I withdraw my motion.
Thank you. My name is Emily Early. I am the Associate Director of the Southern Regional Office of the Center for Constitutional Rights. and I will be giving comments on behalf of my organization. Yeah. Sure, certainly. So first, before I start with my actual comments, I did want to acknowledge that I stand here before this chamber today on the day after the Day of Trans Visibility, which was yesterday on March 31st, 2025. And so I make these comments in solidarity with our transgender community members in the state of Georgia, both within and outside of the prison walls. The Center for Constitutional Rights has litigated landmark civil rights litigation, including on behalf of transgender incarcerated people, and I would like to refrain from using the word inmate, but transgender incarcerated people, and have built community with those individuals across the South and the nation. So we are therefore able to speak firsthand to the importance of health care for transgender individuals, both within and outside of prison cages. First, I would like to identify our strong opposition to Senate Bill 185, which seeks to deny essential evidence-based medical care to transgender individuals with gender dysphoria in the custody of the Georgia Department of Corrections. In so doing, these bills directly contravene 8th Amendment U.S. constitutional protections, as well as protections under the Americans with Disability Act. Gender dysphoria is a recognized medical condition that many transgender people experience. Federal courts, including the 11th Circuit, which is based right here in Atlanta, Georgia, have consistently recognized that gender dysphoria is a serious medical condition requiring individualized, evidence-based medical care under the 8th Amendment. In the context of gender dysphoria, such individualized evidence-based care can include hormone therapy, gender-affirming surgery, and other protections. If adopted, Senate Bill 185 would impose blanket bans on the provision of gender-affirming care to incarcerated people with gender dysphoria, regardless of needs. These blanket bans have repeatedly been found unconstitutional because they show deliberate indifference to the needs of incarcerated people. Even the mere refusal to consider this particular treatment constitutes the very definition of deliberate indifference. I also would like to note that beyond the 8th Amendment, Senate Bill 185 would violate the Americans with Disability Act and Section 1557 of the Affordable Care Act. Secondly, I want to note what some of the members here today have noted, that passing Senate Bill 185 would cost many dollars for the state of Georgia. And it appears here there are some legislators who are concerned about fiscal responsibility. So let's talk about it. This Senate bill puts lives at risk, and in so doing would bring constitutional challenges. A recent Atlanta Journal-Constitution article noted that litigation related to transgender people have cost the state of Georgia and its taxpayers $4.1 million since 2014. I would also like to note, most importantly, that the denial of this care creates an increased risk of severe psychological distress and even suicide for transgender incarcerated individuals. I would like to note, in opposition to what the senator said, gender-affirming care is not elective surgery. It is life-saving surgery. In conclusion, I would urge that Senate Bill 185 is not passed, and along with my transgender community members, the Center for Constitutional Rights stands in opposition to any legislation that endangers lives, violates the Constitution and other federal law, and exposes Georgia, a state in which I am a tax-paying member, to unnecessary financial liability. Thank you for your time today.
Thank you very much. I'm not going to take any questions, and we have several more people to speak, so we're going to time it in about 2 minutes apiece, please. Sarah Hunt Blackwell.
Letters too, if I would like to pass out.
They can pass them down.
Okay, sure.
Okay. Thank you.
Good afternoon, Chair Lady and members of the committee. My name is Sarah Hunt Blackwell. I'm the First Amendment policy advocate at the ACLU of Georgia. I actually have many of the same arguments and stand in opposition to SB 185 as my colleague here who went before me. But just as the courts have repeatedly said this is unconstitutional, I will also repeat that this is unconstitutional. Gender affirming care is medically necessary care. And under the 8th Amendment of the Constitution, the state has a duty to ensure that incarcerated people can access any needed individualized treatment. This bill would run afoul of that duty. Federal as well as state courts are clear. State correctional facilities are required to provide individualized medical care to transgender people who are in their custody. Failing to provide payment for transgender inmates to access gender-affirming care is categorically unconstitutional. Displaying a deliberate indifference to a particular course of treatment for transgender people in custody constitutes cruel and unusual punishment under the 8th Amendment. Gender dysphoria is recognized across the medical community, as was already noted, as a serious medical condition that requires varying forms of gender-affirming care, from social transition to surgical procedures. And the 11th Circuit has unequivocally held that treatment for gender dysphoria is medically necessary care that receives 8th Amendment protection. There is litigation pending in the 11th Circuit right now against the Georgia Department of Corrections for its refusal to provide necessary gender-affirming care to a transgender woman in its custody. The ACLU of Georgia filed an amicus brief in support of the plaintiff, and we reiterate here that current jurisprudence rejects the denial of transgender incarcerated people's rights to gender-affirming care. It is unlikely that this bill would pass constitutional muster under the 8th Amendment, protection against cruel and unusual punishment, and we urge this committee to please vote no on SB 185.
Thank you for being brief.
Thank you.
Thank you. Jeff Graham. We'll see if you can do as well as Ms. Hunt did.
I will certainly do my best, Madam Chair. Thank you for the opportunity to address the committee today. Jeff Graham, Executive Director at Georgia Equality. I know that some of my colleagues will be speaking to the medical issues. You've already heard from my colleagues speaking about the legal issues. There are just 2 points of information that I do want to make sure that the committee has access to. The first one is the Atlanta Journal-Constitution article from a couple of weeks ago that provides details on the $4.1 million that Georgia taxpayers have paid out into these 19 lawsuits that the state of Georgia has not won a single one. So it is costing taxpayers dollars, and I'm sure that the $4.1 million is much higher than the cost of medical care to 5 individuals within the Department of Corrections. The other thing I just want to make sure that the committee is aware of is that there is a Supreme Court case pending before the U.S. Supreme Court that does concern the constitutionality of medical care for transgender individuals. U.S. versus Scrimeti. Oral arguments were heard in December. We anticipate a ruling by the end of June. While that specifically had to do with whether or not states could legislate and restrict access to healthcare services for transgender individuals, specifically minors, I do think that it would be prudent to wait to see what the U.S. Supreme Court has to say in regards to this matter, whether they will affirm that it is unconstitutional to withhold medical care in all instances, or whether they would provide some instances where restrictions could take place. So I urge you to be very prudent. There is no reason to rush judgment on this issue when it is pending before the Supreme Court. Thank you, Madam Chair.
Thank you for that. Dr. Cassie Ackley,
Hi, thank you very much.
If you'll pull the mic down towards you a little bit.
I will. Is that better? Yeah, thank you. My name is Cassie Grimsley Ackerley. I am a physician here in Georgia, and I treat patients of all gender identities. I am firmly opposed to SB 185. This is a bill that would restrict access to gender-affirming care. We've heard this a lot, which is evidence-based care. That means it's the standard of care supported by every major medical organization in the United States, and for good reason. It is indisputable the amount of evidence that supports the benefits of gender-affirming care. Let me first provide some context. So transgender people endure significant discrimination, not only at the Capitol, but out in society as well, and increased economic insecurity, which can lead to homelessness. These are folks who are also targeted by police and are more likely to face criminalization and incarceration. So we're saying that this population that is already at risk of criminalization is now going to face further discrimination, because when they are incarcerated, they will not be able to access evidence-based medical care. Let's consider an example. We have a 48-year-old transgender woman who has been taking gender-affirming hormone therapy for 20 years. She's lived her life as a woman for 20 years. She is physically attacked in a grocery store parking lot. And she fights back. So when the police come, she is arrested, she is charged as well, and now she is incarcerated. What this bill would do is it would prevent her from being able to continue on her medications, which she has been on for years, and which have been prescribed and provided by her medical provider. Let's be clear. This policy is cruel and it's egregious. She does not have the opportunity while in prison to look for medical care on her own, to find that care. She basically is left without care altogether. I'll just finish by saying, I would ask you all to remember your humanity and your duty in caring for and providing for the people of Georgia, all of the people of Georgia, including people who are incarcerated. They have rights to medical care and deserve that care. So I urge you to vote no on SB 185. Thank you.
Madison?
Yeah, so I am trained in internal medicine and pediatrics. I'm an infectious disease physician, but I do research that engages with transgender and gender diverse people. So I'm connected to the community and I'm privileged to do that. Thank you.
Thank you, and thank you for the areas, because that was a variety of areas that you do and that you live in Georgia. We need all kinds of doctors. Thank you.
Thank you.
Okay, who have I got next? Bentley Hudgens.
Good afternoon. Thank you for this opportunity to speak. Thank you, Chairwoman. Thank you, Committee. My name is Bentley Hudgens. I am the Georgia State Director of the Human Rights Campaign. We represent 3 million members, or now 3.5 million members nationwide, and 200,000 members here in Georgia. My colleagues before me have addressed constitutionality and other claims. I had a speech for you, but I want to challenge something that was raised by Representative Hilton, that this is an 80-20 issue, that everyone actually wants this to pass. In all the exit polling that we were privy to, and ones that we did and other ones that we did not do, even GOP or Republican-backed polls, limiting the rights of transgender people was at the bottom of the list of priorities for voters. It was about 4% across all of the polls. And even if we were to assume that the majority of people thinks that their priority in the legislature is to limit the rights of a very small group of people while they are incarcerated, I would also challenge that as a mandate to pass this legislation. This bill is unconstitutional. We have seen time and time again in history where powerful people have used public opinion to excuse crimes against humanity. There was times in the United States where gay marriage was unpopular. There are times in the United States where slavery was popular. There's times in the United States where people who are seen as lesser than, but just because of who they are, their rights and their protections under the Constitution were not seen as popular. So I do want to challenge that notion that just because, even if it were true, that the majority of people think that this is a popular issue, it doesn't give you the right to pass it. Thank you.
Mel's Brook, or was it Brooks Mel's?
No, I am not Mel's Brooks. We are both Jewish, but easy mistake. Good afternoon. My name is Brooke Mells. I'm a legislative advocate and case law researcher, and unfortunately also I'm an asthmatic suffering in Georgia. Please help me. So please bear with me, and if y'all need me to repeat anything, feel free to. I'm a little hoarse with all the lovely pollen outside. So luckily the paralegals back there did a wonderful job going over the jurisprudence surrounding it, but I did want to touch on some of the previous unfiled records in relation to case law, and specifically touching on a few lines. So if y'all will bear with me with flipping through the current LC, let's go through lines 71 through 72. It talks about cosmetics, and I've had a chance of passing this over with a few paralegal experts of my own, and the conclusion we've come to is that this would not only bar cosmetic procedures, but it would also permit the Georgia Department of Corrections to shave the heads of transgender women in incarceration, and that's a little cruel, just a little bit. And for lines 76 through 78, insists that gender-affirming care is non-essential, whereas we've seen from the previous medical personnel that is absolutely not the case. For lines 83 through 85, the paralegal counsel I've been in contact with have been able to read that as potentially forcibly injecting transgender women with testosterone as a means of forcibly detransitioning them. And if y'all are wondering what happens when you try to detransition a trans woman, here is what the 11th Circuit and medical personnel have recognized within the previous case law. Osteoporosis, night sweats, hot flashes, joint pain, muscle aches, heart palpitations, hair loss, cognitive impairment, chest pains, depression, suicidal ideation, severe distress, and even death. The 11th Circuit has not ruled that these kinds of policies are constitutional. And in terms of polling for this kind of issue, as of last week, Data for Progress has ruled it's found nonpartisanly that there is a majority of opposition to these types of policies. So thank you very much. If y'all have any questions, feel free to field them my way.
Thank you. Okay. And last, Lydia Willenberger. Well, no, it's not Willoughby, I don't think. Is we just plain Willoughby? Yeah. Okay, I wouldn't have spelled it that way, but I'm not the best speller in the world as it is, so.
Hi everybody. Yeah, my name is Lydia Willoughby. Glad to get that out of the way. I'm speaking in opposition to this bill. I'm just a Georgia taxpayer, a citizen here in Atlanta, and as a member of the queer community, I know from personal experience of loved ones who I have known who have passed away from suicide and other issues that this is a very real and very important issue. I encourage you to look at the actual DSM-5 and realize that it includes people who have already socialized. I don't know, this is just cruel and unusual. It violates the 8th Amendment, it violates the 5th Amendment's Equal Protection Clause. Yeah, thank you.
And that's everybody that signed up to speak on the bill. Okay, Representative Hilton.
Thank you, Madam Chair. Excuse me. Just to want to correct the record on two quick things. I got a friendly text from the audience member. There were actually not 300 murders. It was 62 murders, which any is not good. 248 natural deaths. So 62 murders out of 50,000. So, yeah, and the Georgia Department of Corrections. Yeah. So I do want to applaud what this body has done in terms of money toward our prisons and kind of hearing what's been going on. I do want to correct the record. I think the only 80-20 issue down here is getting rid of school cameras, as I told my seatmate here. Trying to bring levity here, guys. All right. All right. Yeah, I'll stop while I'm ahead, and I'd like to make a motion to pass.
Okay, I have a motion to pass. Do I have a second?
Second.
Okay. The committee, do I have other comments from the committee or questions? Jenna, Carla, Representative.
Thank you, Madam Chair. Based on what the senator, the way the senator presented the bill was that this was about a study committee where the study committee found that there were costs associated with care, and this was the driving factor behind the study committee. However, we've heard testimony now that if we did just a rough cost-benefit analysis here, that the cost of lawsuits far outweighs the cost of care. And I would like to offer a different motion, Madam Chair, and that is to move to table.
To table goes before the other motion. So I have a motion to table the bill. Do I hear a second?
Second.
Okay, I have a motion and a second. Everyone in favor of tabling the bill, say aye.
Aye.
Everyone opposed? No. I think the noes have it. So, thank you. Okay, Representative Cannon, you had it. Are you still, or is that from earlier?
I wanted to have some discussion on either motion.
I think we're already past the tabling, and we're back to the motion that's on the floor about passage. If it's not really a question or just a brief statement, I'm going to lose, I'm afraid, my quota if we don't, move along. We have other things to do. So, very succinctly, please.
Sure. I mean, procedurally, we've had members who didn't hear the testimony, just came in to vote on this bill. You have maintained quorum, and even if all of the minority members left, you'd still have quorum. I just wanted to be clear, going on the record, this bill directly impacts Lynch versus Lewis 2015, Diamond versus Ward 2022. We have been made aware of the issues related to transitioning folks off of healthcare if they are become incarcerated. And so I just must say that I'm hopeful that the members who might vote in support of this will consider some small changes to this bill, specifically lines 83 through 85, 71 through 74. I already spoke to the concerns that I had with this measure with the senator, focusing on this one population and no other populations that are costing the state so much money. And so I'm just hopeful that there will be work done to this bill. And again, I really supported that motion to table because this bill, the language from this bill already passed about 30 minutes ago in the other health committee in Senate Bill 39. So I just don't understand why we're putting this in twice. Thank you.
I think because of the late time we have left in days to consider such things, there is not time in this committee, and I'm going to move the bill forward because I have not heard what was done in the other committee and not have been notified, and I will leave that up to the Legislative Council if both of them pass out, and they can decide how they conflict and which one they want to move if there is a problem with moving both of them. So now the stance we're in, I have a motion and a second for do pass on the substitute to the House bill that we have been discussing, Senate Bill 185, LC 394625S. No, 25, no S. Everyone in the favor of the passage of the bill say aye. Aye. Everyone opposed say no.
No.
The ayes have it. Thank you, and thank you to everybody who came. I will tell you, and to the audience here, I appreciate your comments. The decisions we made are often, and my committee members are very thoughtful in what they do. Sometimes the decisions we make are very hard, but I can tell you that my committee cares about people, even if it's not the way you wanted it to go, and I appreciate their work on issues. All right. The House sponsor, who's going to carry this in the House?
Representative Hilton and the departments let me know if there's anyone else.
Okay, Representative Hilton. Okay. All right. Let's call up Senate Bill 101. Thank you, Senator, if you need to. Thank you.
Yes, ma'am. Thank you.
You're welcome. Clark, you coming? Sorry. Come and explain what you did to this bill.
Thank you, Madam Chair. I don't have the substitute in front of me, but it's the Senate Bill 101 substitute, and it's just the same language that we passed out almost unanimously. There was 2 no votes. And it had to do with prosthetics and orthotics, and it got over to the Senate, and we had a little bit of issue, and one of the senators let me take control of his bill Senator Robertson, and so we're gutting the language he had, putting in the language that we passed in the House, and so now Senate Bill 87 will become House Bill 87 will become Senate Bill 101.
We didn't have that in our committee going the first round, did we?
No, it went through the Health Committee
Okay,
in the House.
basically and quickly, now that you have a copy, just tell this committee, who hadn't heard this bill, what the first bill was about.
Yep.
Very quickly.
House Bill 87 it allows, right now, currently in Georgia law, you only get like one prosthetic every 3 years. This would allow a possible 2 additional, so you can go shower, because right now the standard prosthetic, you can't go shower, you can't go exercise, you can't go run. And I know a lot of y'all met Elliot, that 6-year-old who came down so everybody can move day. And this would allow, Elliot, he could go take a shower, just live it like all of us, just a normal life, and be able to go play with his twin brother. So that's what it does. We had worked out with the insurance companies, and they were all in agreement. We had worked for 2 months on that. And the medical necessity, we use the language like the VA uses. And so that's pretty much what it does, just allows them to have additional, if a doctor recommends it, based on the medical necessity for approval.
Okay, what was the opposition in the Senate?
We just have enough time, and then by the time to have the vote, we just went this route because we're down to the deadline.
Okay, Representative Cannon has a question for you.
Sure, thank you for this legislation. On line 112, why are we wanting to know about the policy years 2026 to 2030 in the year of 2032? What is that time frame for?
This is just so we get a report to kind of see a report on just to look back and just look at what we're passing on how it's helping and all that to just get an update on that.
Okay, from
what I know.
So the commissioner has requested 2.5 years after this policy has been in effect for 4 years to give a report. They've asked for that much time.
Yes, I think that's why we put that in there. I never asked that in health, but it's just to get a report so we can look back. The commissioner can look at.
Don't you think it's a little atypical that we don't give a report until 2.5 years after the program has already, or the benefit has already been running for 4 years? If we're trying to find efficiencies or nooks and crannies, wouldn't we want to maybe have that report sooner? That would be the only thing I'm concerned about.
I mean, in our amendment, and if you do, hang on to it, and when we get to where we're discussing things and we decide what we want to do the bills, you can make an amendment if you'd like to, if it's just the date and time. Who else we got up there? Representative Al.
Thank you, Madam Chairman. We've heard this bill before, and we voted it cleanly out of the House. At the appropriate time, I'd like to make a motion to pass. It's important for our patients for
Okay,
mobility
so
and
we have,
orthotics. Thank you.
all right. Any other discussion? Anybody that wants to speak to the bill? Okay, don't see anybody coming forward. Okay, what's the committee's stance on this? We have do pass, sorry, we have do pass. And a second? Okay, I'm tired. Okay, Representative, do you want to make propose an amendment?
I do, on line 105, to change the year 2032 to 2030.
Okay, do I have a second on that?
I have a question about that.
Okay.
Can I ask a question about that?
Sure, go ahead.
I don't know what all goes into collecting data from all these different insurance companies, but perhaps it might take a little bit longer than by the end of 2030, maybe 2030, I don't know, 2031. Is that, that's a lot of data probably to pull
Yeah, I think what they gave the 2 years is just, you have 4 years to collect it all, and then, it does take some time just to put together, so
I don't know.
we could change it, but
affect. Yeah, I don't know how many that would affect, but just curious.
I would just say keep it as is, but if y'all want to change it, we can, but.
Thank you, Madam Chair. That's where I was going to go with this. It takes longer for a variety of all the different resources that you're going to be using to get that data together. And if the department is the one that's being involved doing it, it will take longer. I mean, each individual carrier will have to develop their source to get the information and get it to them. That's why it's 2 years. Thank you.
All right, okay, I think I don't see anybody else asking a question.
So what happens between the years 2030 and 2032 to this provision? Are we waiting on the report? Are we still doing the same things and then we get a report 2 years later that says didn't work so well? Again, I still did want to amend it to make that report closer. I've seen lots of other bills where the report is within 6 months and we're talking about statewide data. I'm not sure that there are. Do you know about how many individuals this will impact? How many people will be using this provision?
I think it's around now. Don't get me wrong. I think around. Well, I mean,
Under 1,000.
it is small.
Right. So you know.
No, it's definitely larger than that.
Okay.
I don't want to say the wrong number. It's definitely larger than that. But having the 2 years, they collect it, and then just make sure we have the right data from the different insurance and all that, putting that together. And it's not going to stop adults and kids being able to get their prosthetics and orthotics. So
What committee did this come out of?
health.
Or just the regular health? Did the chairman of that committee ask for a fiscal note, as I like to say? A fiscal note, a fiscal note.
So
Did he ask for one?
So, so we don't need a physical note because we don't have, and to update one last thing, we had the state healthcare plan. We're working through that. So in the Senate, we did remove that. I talked with the governor because we're still working out the state healthcare plan. But this would still be a massive step forward in helping people throughout Georgia. But we don't need a physical note on this. We worked out with the insurance companies, but we're still working out a few things on the state healthcare.
So the governor's office said you didn't need a note on how?
No, because this is with insurance companies, so we're good to go. The
Okay,
state
just
healthcare plan,
it's
we're still
not-
working out the physical note, but I don't want us to stall doing good things for Georgia and impacting a lot of people in Georgia. If we move forward, this will help a majority of them.
Okay.
And I'll be working next year on the state healthcare plan.
Okay. All right, let's vote on the representative's amendment. Everybody in favor of Representative Cannon's amendment, say aye. Aye. Everyone opposed, say no. No. I think the noes have it. Okay, then we were back to our original position, and I don't see any other questions or suggestions. So everybody in favor of the passage of the substitute to Senate Bill 101, LC 600167S, say aye. Aye. Anyone opposed? No.
No.
Okay, the ayes have it. Okay, let's move on through. Thank you very much.
Thank you, Madam Chair.
You're welcome. Let's go. Pardon?
Can we do a hand raise on that?
Do you want a hand raise on that one? Sure. Let's go back. Everybody in favor of the passage of the substitute to Senate Bill 101 that said no, and now is in favor of the bill, please raise your hand. Okay. All right. Everyone opposed? Okay. Thank you. Huh? Who's the House sponsor on the bill? What?
Oh, sorry.
Oh, he's out. Okay. All right. Didn't get me in time. Okay, where are we down to? Okay, let's go with, let's go. HR 304, LC 46094. Representative Al. Succinct as you can be.
Absolutely. Oh, there we go. Thank you so much. So this is a study committee resolution that I've been working on for 5 years now that would aim to create a study committee to evaluate the healthcare costs of smoking in Georgia, of tobacco smoking, in specific cigarette smoking. So I don't think Georgia's looked at this issue of these health costs for at least the past 2 decades, which is how long it's been since we've raised the state tobacco tax, and looked at those costs. Just so that people understand what I mean by cost, It encapsulates several different things. First of all, how much are we paying to cover the health costs of those who choose to smoke? What is the breakdown of how these costs are paid? How much is paid through the state health insurance program? How much is paid through Medicare or private insurance? Who is incurring these costs? How has this changed over time? There are other expenses that it's important to look at, too, that would be part of the study committee. For example, what is the cost of the chronic disease burden on our society? What's the cost to industry and worker productivity of these chronic diseases? How many days do we lose of work? How many life years do we lose? How does it affect the quality of life? And how does it affect children with respect to secondhand smoking and school absenteeism? These are all things that are part of this study committee that it's important for us to look at to inform future legislation to address this costly issue for the state of Georgia. I'm going to leave it at that. I have a packet that you guys can look through that gives some background on these issues, and I will be succinct.
Okay. Everybody
Happy to take
have
questions.
questions? Anybody have questions about House Resolution 304? Who's number 9? Is it?
it's me,
Yours,
sorry.
it's on. No questions from the committee? Oh, okay.
Thank you, Madam Chair. When you said smoking, would you include vaping in that study as well?
Thank you for that question. How this study committee was originally envisioned was that it could include vaping, right? And you'll notice there actually are two bills addressing finding ways to cover those costs in the House right now. One is a cigarette smoking bill, and one has to do with the cost of vaping. I broke those apart separately because vaping is sometimes handled a little bit differently because it's a little bit of a newer modality that is a little bit less studied. But certainly I'm open to including that in that, especially since there's a rise in vaping in youth smokers in particular, and I think that that is a very interesting aspect that we should look at, especially when we talk about regulating vapes.
Gee whiz, I thought you were going to invoke the Chocus rule, and you were going to ask not to vote on the issue.
I think he wants to move to pass.
So
That's what he's saying.
the group's very solemn today. It's not, I guess it's late, they're tired and everybody's late in session and lost a little bit of their, go ahead.
We did have a vape study last summer, yes.
Oh, okay.
So, met 5 times. I was a part of that vape committee, so.
Okay. Do you make any recommendations?
We had a bill that
Oh.
came out.
Okay.
Of that recommendation,
Okay.
of the study, there was a bill that came out.
Yes.
Did it pass? Or is it moving?
I don't think it passed
Moved her.
across the hall.
Okay. Well, it's still alive. If it doesn't pass by Friday, it'll still be alive. Okay. Representative Hilton.
So I'm going through the whereases, and it seems the substance begins at 23 to 26, whereas it would be beneficial to examine the cost of smoking. I would assume that's fairly easy to. I know, and the reason I've asked this is I had a bill this year, and they gave me a number, the cost or the impact on Medicaid. So it seemed like it was something readily available, which may not require a study committee to look at. It's maybe not as simple as Googleable, but I think DCH would be able to provide that to us pretty quick.
Well, if I could answer that question, I know this is something that Representative Hilton is very interested in, especially in terms of moving towards implementing more modalities to support smoking cessation in the state because it is such a costly behavior. I think there are some things that you could readily Google. In fact, that's how we found some of these documents. But as I presented in the beginning, there are many aspects to how tobacco smoke and that burden costs the state, not just purely in terms of how much Medicaid or Medicare pays for it. And I'm just going to go through this again because I mentioned them. We would probably want to look through not just how much it is costing, but the breakdown of how these costs are paid across different types of health insurance programs, right? How much is paid through state health insurance programs, how much through Medicare, how much through private insurance, who is incurring those costs, how has this changed over time, right? Because different patient populations are supported by different types of health insurance. Other expenses that I think are more important to quantify, more than purely how much we're outlaying as a state, the cost of the chronic disease burden on our society, the cost to work productivity, the cost of school absenteeism. These are all aspects that we should tie together because they can inform many types of future legislation that I would think we'd want to work on as
I think we're going to do all that work, and we're going to find it costs a lot. And so what I'm trying to do is beef up that section to get to the so what, you know, like to add a little more muscle to the bone here of, we all know the answer, it's a lot, you know, and so help guide me toward the ultimate objective of the committee rather than just a blanket policy.
Right. So, no, the point of the study committee is not to generate a Post-it note that has a lot written on it. Certainly, we would want to do more than that. One of the things that I think this resolution was intended to do is to provide a rationale between this and another bill that we heard in Ways and Means just this last week, which is a bill to look at modernizing the state user's fee for partaking in cigarettes, right? Because when we talk about modernizing that user's fee, meaning raising the state tobacco tax, right, the cigarette tax in specific, it basically helps people who choose to smoke take that personal responsibility and help fund the higher healthcare costs that they incur as a result of that behavior.
So I guess I would.
So that is one thing, and we can also look at some other aspects.
I guess I would suggest adding that as an amendment then at the appropriate time, line 26, sort of comma with the goal of produce or something. I'm trying to create words on the fly here, with the goal of examining Georgia's tax policy toward smoking.
Well, I don't want to too narrowly tailor what the purpose of the study committee report would put out. That could certainly be part of it. I'm open to that, but I certainly don't want to introduce over specificity that would lead people to not want to look into this issue, right? Because it is a quite broad issue, as you're saying.
I guess I'm just trying to avoid 3 meetings of us getting together saying smoking is bad.
Well, we could certainly say more things than that, and I'd be happy to have you on the committee when we look at that.
I've been signed up for all kinds of stuff today, so yeah, happy to join you.
The first member on the study committee once we pass it. I'm happy to
Love it.
I'm sorry, Representative Dow, you don't get to have him because I'm having sort of an unofficial study committee that chairman can do. And I need him on that one first, so all right, you just have to give him up.
I need you too, Madam Chair. Thank you.
I think so. And I think that there's room, and I was going to say, considering that it's Representative Al asking for this study committee, we will probably have more information than we ever thought we needed. So I'll sort of I would, in my opinion, humble opinion, I would, if I were voting, I would vote for it, but you vote however you want to. So, all right. We've lit up the board. Do we really need to continue on this, or is this something? I don't think so. Okay. I need a motion. We didn't get to that, did we? Oh, we have people. We're going to be here forever, guys, but that's okay. Not 2 hours yet. Okay, we have 3 people to talk. Anna from MAG. Anna.
Thank you, Madam Chair. I would just like to say that the Medical Association of Georgia is in full support of this bill. Thank you.
Thank
Anna
you.
Ruzicka.
Dana Thompson.
Hi, I'll keep this brief. Dana Thompson, Director of Advocacy for the American Lung Association. We fully support this bill and want to participate in the study committee as best we can. Thank you.
Thank you. And Danny Kenso? How you pronounce your last name?
Danny Canso. Thank you, Madam Chair. Thank you
Okay.
to Representative Al for bringing this measure forward with the Georgia Budget and Policy Institute. Just wanted to express our strong support for this bill. Give you a couple of brief points. Say that, next year the state anticipates that about 319 million packs of cigarettes will be sold and smoked in Georgia. Our best estimate right now is that about $699 million in Medicaid costs alone are due to smoking. So very important issue, and will be great to be able to dive into that a little bit further. So thank you for considering this measure.
Okay. I am going to, being chairman for a long time, I can tell you how much fun this is. I don't think anybody here, does anybody remember Dr. Thomas? a little tiny doctor sort of shriveled up from Dalton, and everybody, he was the head of the health committee, and everybody loved Dr. Thomas. So I'm sitting at my desk, I'm chairman of health, and all of a sudden, I'm getting all the senators. I mean, I had 4 or 5 of them. You got to kill this bill. You got to kill this bill. And I said, what are you talking about? What am I killing? Well, we just passed a total smoking ban. And I said, why would I kill it? I'd like to have a total smoking ban. And they said, well, no, you got to kill it. And I said, well, did it pass by just one vote? Oh, no, almost everybody, the whole Senate voted for it. And I said, well, then why are you over here telling me I have to change? Oh, we all love Dr. Thomas, and we didn't want to hurt his feelings. So you have to change the smoking ban. And at one time I said, do you know how close I am to Dr. Thomas? So anyway. But there was a little place that changed our side called, oh golly, there's a place off Piedmont Road where they like to smoke cigars and drink liquor. And they were a big lobbying firm that got it down, and that's why we have the bill we have today. Can I have a motion on this bill?
Yes.
Move. Thank you. In a second. We got a motion in a second. What?
All of them. Move on all of the states right there. Move to pass.
No, all right, we got to pass. Everybody in favor say aye. Aye. Anybody opposed? Oh, you're a mess. Okay. All right, let's go. Okay. Let's do the next one. Okay. I think, who's up? Who's up on the thing? We're having trouble here. Which one is it? Mark Newton. Okay, Dr. Newton, come on. House Resolution 593, LC 600139. I've added to how long that took me to say that, so I'm taking a minute off your time. Talk fast. No, you're fine. You say what you want to say.
Georgia is very blessed to have some of the highest and most prestigious OB and pediatric and prenatal care in Georgia, but we also have a lot of rural areas that are not so blessed and that are very challenged. As the chair lady knows, we've co-chaired a committee on maternal mortality. Still, the fact that we're still 49th in maternal mortality, we have some challenges. We've made great progress, as the chair lady mentioned. When I know I came in earlier, the Department of Public Health has made much advancements. I know we have what are called AIM bundles, Alliance for Innovation in Maternal Health. A number of our rural hospitals have adopted those, things like hemorrhage and hypertension, things that are preventable. We've made progress, but not in every area. So what this bill would do would establish a study committee. It would help us do several things. One is look at the current situation of obstetric care, especially across rural Georgia. And of course, when I say obstetric, I mean prenatal and neonatal as well as the immediate pediatric care that goes along with that. We have some great institutions reaching out, like CHOA, reaching out into rural areas already to deal with pediatric care. But we want to look at the current situation, possibly look at the travel distances from other hospitals. I know I've had those who've discussed the fact that what's the sustainable number of deliveries a hospital has to do so they don't have to lose money on their program or even close their program like so many hospitals in Georgia have had to do. What's the minimum sustainable amount that can attract the maternity care staff as well as the OB physicians and things that you need? So we want to look at travel distances, possibly avenues. I know DPH is looking at ways, expedited transport. If you live in a county that doesn't support an OB hospital, well then what about assisting, what can we do with the travel without taking the single ambulance from a county to take someone 45 or 60 minutes away? I also want to look at the funding. We have if anybody remembers our former commissioner of health talking about DPP money, the waterfall, kind of understanding disproportionate share. We actually, some of our rural hospitals do enough deliveries, they might be included in some future graduate medical education in some areas we can increase funding to help those hospitals, to help them sustain that. And of course, everybody knows about our Georgia Heart Program, that's our rural hospital tax incentive. What this bill would do would be to start to bring together all these different pieces from the current situation, from where we'd like to be, from what's sustainable, how can we get it all funded in such a way that it is sustainable and that it can be state-of-the-art care in various areas of Georgia. And so that's what this bill would help us do, is to put together a study committee to kind of draw all those different areas together in a way that we can make some recommendations. I know with the chair lady of Subcommittee on Health and members of the Subcommittee on Health Appropriations, that can be a great deal to inform those decisions on where does the state go next in in trying to help solve not just the mortality issue, which is a very small number, but the near misses and the morbidity and the expensive care for neonatal care and new children that are born. So healthy mothers, healthy babies certainly informs a lot of this. So that's the goal and the rationale behind taking a closer look at this, maybe taking it a step beyond just the maternal mortality that we looked at, but seeing how we can put our money where our mouth is if it might lead to that. So that's the bill, that's the resolution for a study committee.
I heard somebody discussing this, and they came up with the idea that it would be a whole lot cheaper for us if we had a high-risk pregnancy, just to put the mother and the dad in the hotel where the main birthing area was.
Thank you. Yeah, that has been one
so we
suggestion.
come out cheaper than having a low birth weight or trouble with a mother. And you know what? If they come from a county where there's one ambulance and you can't take that one ambulance away, or it might not be available, it might be a good idea now, but thinking out of the box. However, I don't like your ranking, and I will thank the lady who ranked us 45th.
Oh,
do you see what I mean?
Sorry, I came in
There
late
is
today.
no one telling which really tells us which we are ranking, and I've had a ranking that was higher than that, and we were higher than all the lower states around us. So get together. Hers was 45. I won't talk about it. Okay, I have all these people on this. Chokus, did you want to make just make a motion?
I just wanted to make a motion.
Hold on a minute. Representative Barnes, go for it, quickly.
Chair Lady. Thank
Like
you,
your
Dr.
hat.
Newton. I've done a lot of research on this, actually, and I was wondering what your, if maternal mobile units would help mitigate this issue.
Well, that certainly could be something we could look at. That might be a more expensive one than the chair lady's suggestion of the last week of pregnancy across the street from a top-notch hospital. Not sure what. That's one of the things we'd like to look at in this is, do we take the care to the rural counties in particular, the underserved counties, or do we find ways to assist with transportation in whatever way is best?
Yeah, if we could send those mobile units to our maternity deserts, which I have identified, but I would love to work with you on that study committee.
Thank you.
Keep your hands off my mental health crisis emergency. I'm teasing you. They have such trouble taking care of our mental health. We maybe have to find a way to help us, the maternal health. Representative Cannon.
Thank you for working on this. As you know, I'm interested in this. I put into bills yesterday, just trying to figure out how we address funding. We need more than just government resources. I would be remiss if I didn't, thank former Representative Abel Mabel Thomas for helping us to extend Mama Medicaid and to find some funding streams that actually reach those moms who are rural. I just have a question. Are non-legislative members able to be on study committees?
This particular one is members of the House of Representatives.
Yeah, I was
They
just
certainly
saying in
could be,
general, are they allowed?
It's not prohibited.
Yeah,
Correct.
so why not in this one?
I think we will hear from a lot of non-legislative members, but the goal of the study committee is to come up with legislation, which is going to hopefully the members of the committee will all be in favor of signing it, and we can actually move forward to funding and actual legislation.
Okay.
So much, Chair Lady. Representative Barnes, it's interesting that you said that about the mobile clinic about 30 years ago. I actually did rotations as a student nurse. We had a little mobile clinic about an hour from where I lived, and it worked really well. It was great. I don't know if it was a pilot program, but it was a wonderful thing to be able to go around and you made appointments and stuff. I love this. I think it's great. I think it's much needed. Obviously, from the person from Valdosta that spoke to us earlier, we obviously need this bill. So I would like to make a motion at the time. Do pass.
You're going to have to fight with Chokus. Do you want to send Chokus?
I got him. I got him.
Okay, no, he's not. You're going to have to second it. Hold on. Hilton, Representative Hilton.
Thank you.
Last question.
Dr. Newton, refresh my memory here. Didn't we pass a maternal mortality commission last year?
We have a maternal mortality review commission that's been in for maybe 10 years that has been gathering the data, and we actually did after our study committee, we actually expedited them. They were usually 2 years in arrears on the data. We gave them more resources, and we have been receiving more timely. It's still very difficult. If you remember a couple of years ago, we added some information to our our death certificates, just to make sure that it was a better capture of pregnancy-associated or pregnancy-related.
Will there be overlap in the two, though? I mean, if we already have a committee in place, a permanent committee looking at this.
Well, they're just looking at mortality is all they're looking at. And they did, as you mentioned, though, there was the AIM bundles, the Alliance for Innovation in Maternal Health. And so there were some legislative outcomes that came out of that commission, but their goal is just to provide data to us strictly as it relates to the worst of all outcomes, which is a death.
Passed, because we have all the members are new on the maternal mortality review board, all new. And so we did get an oversight. We just passed it to help that committee.
Yes,
so we put an oversight group. I think that came out last year under Lauren, pretty redhead that had the baby, I think, Laura Daniels, and that we re-added some stuff to it this year. It's in the passage this year to help them with it. So we've done that. I think he's just trying to come up with different ideas. Okay, Chokas, you're on, and let Representative Osteen second it.
I'd like to move that House Resolution 593 LC 600139 receive the due pass recommendation.
Second. Okay, we got a second. Okay, Callan Wells, we have somebody who wants to speak on it? No?
We're saying that we support it.
You support it? Okay, great. Okay, thank you.
Founding Executive Director of Cisco Birth Initiative of Valdosta, Georgia. Telehealth is a critical piece of this, especially in those rural areas. Community-based organization support and input is critical because, again, we are boots on the ground. We are there, and we see what really happens every day. And I think a big piece of what's missing is our input. And the focus on fathers. Fathers also need to be included in this because when we have healthier fathers, mentally, financially, and everything, we see better health care, better health outcomes for mother and infants. Thank you.
Thank you.
Okay, we have a motion to do pass in a second. Anybody else want to say anything? Good. Okay, everybody for the passage of this bill, say aye. Anyone opposed? No? Okay, the ayes have it. Okay, we got one left down there on the corner. Okay, here we go. Where do we get? Where do you guys like that?
Thank you, Madam Chair. This afternoon, I'm bringing you House Resolution 847 LC 570284. This is the easiest one you'll hear all day. It's to help create a House study committee on evaluating the funding for the health department, the public health. They are a very hard-working group. They have a lot that they do and have to cover. I think we can help them. There's a concern about funding as everything, but we've had a lot of growth in our state. They've had to deal with a pandemic, natural disasters that affect our health and our areas. Even now, the rest of the country is dealing with measles. I just want to make sure that they're having the funds that they need and we have the opportunity to help them and see where their needs are and help them to fulfill their mission, which is keeping Georgians healthy. That's what the bill does.
Much. Anybody got a burning question from the committee? Okay. Well, we will have a motion from Representative Chokas.
Yes, ma'am. I would like to move that House Resolution 847 LC 570284 receive the due pass recommendation.
Second. Okay, and we do have three people who want to speak. Leah Chan? Leah Chan, okay.
Thank you, Chair Taylor, and for bringing this bill, and to Chair Cooper and members of the committee. I'm Leah Chan, Director of Health Justice at Georgia Budget and Policy Institute, and we are in strong support of House Resolution 847 and the opportunity to evaluate funding for the Department of Public Health. This really just gives us an opportunity to shine a light on the critically important role that the department plays in keeping our state safe and healthy and keeping our economy thriving. So just a couple of facts. So as the saying goes, an ounce of prevention is worth a pound of cure. And we know that public health really delivers a strong return on investment. So data show that increases in public health spending are linked to decreases in preventable deaths. And for every $1 that the state invests in public health, states have seen that it yields about $67 in savings thanks to improved health outcomes. So Department of Public Health's budget has remained relatively low since it became a freestanding agency or department in 2011. So if you look at our state health spending across the board for our 3 primary state health agencies, only about 10% or less than 10% of state health spending goes to Department of Public Health. So this study committee is just an opportunity to talk about how to build on the state's strengths we have in our state and local public health system, how to modernize, and how to really create the conditions where everyone can thrive. So thank you so much.
Thank you. Whitney Griggs?
Georgians for a Healthy Future supports the bill.
Thank you. And Callan Wells?
Also, GEAR supports.
Okay, thank you. Okay, I would think that we are having maybe a suggestion or discussion that's coming up from the sound going on down at the corner. What you need?
Sorry.
Representative Hilton? Or do you have a?
No, I'd like, at the appropriate time, I'd like to make an amendment.
Okay, let's see, do I have a motion on the House resolution as it stands? Okay, got a motion and a second? Okay, all right, we got a motion and a second for the bill, the House resolution to pass. What is your amendment?
Beginning on line 7, it would read, whereas, comma, increases in public health spending have been shown, and just continue there. And then on line 10, whereas, comma, public health has historically been underfunded. Those would be the only changes.
What line to against?
It would be line 7, whereas, comma, increases in public health spending have been shown, and then line 10, whereas, comma, public health has historically been underfunded.
Okay. Any discussion on that? We will. I just want to see if anybody, I don't want to say anything, and I don't see anybody, so we need a. Okay, we need a motion on the amendment. So moved. Do I have a second? Pardon?
10.
What?
7 and 10.
I can't, there's this. No? Or what do you say? Well, we're not voting yet, because I need a, did I miss a second?
Katie second.
Oh, okay, okay. All right. She made the motion, so thank you. And, all right, Representative Howe, do you have something to say before we vote on the amendment?
All right, so the amendment in line 7 and 10 is basically to strike where it says, according to the Georgia Budget and Policy Institute?
Correct.
Okay.
Okay. And
All right.
Same thing in 10?
Correct.
Okay.
All right. So, we ready to go? Yes. Okay. Everybody in favor of the passage of the amendment as read, say aye. Aye. Anyone opposed?
No. Why are we taking out the group of people who are going to help you and who just testified in support of it?
Okay, Representative Dempsey?
Discussed it a little bit, I will say that. I think, I don't want to speak for Representative Hilton, but I know on study committees, of course, some that can limit it. When you, anybody, it could be any name of any organization, I think the idea is that they would be testifying and be part of it rather than limiting any of the conversation, is the way I'm reading it. I don't know. You may need to explain your real intent.
Anybody else? Okay, Representative
I mean, GPBI is a nonpartisan group that gives us facts and figures. I mean, straight up and down the board. I don't understand why including their name does anything untoward towards expanding the issue, expanding the conversation.
Representative Cannon?
Yes.
I'm not as nice as Katie Dempsey, Representative Dempsey is in her kind way of putting it. But there are people who don't feel that way about that group. And in an attempt to make sure that we did this and that they still come and certainly are welcome and there's no prejudice against them on the committee or about the committee, whether we get to do it or not, it's sometimes better to just pass things out and without a name on it, so they will come to the committee and share all their good work with us. And that's just the truth. And as Rosanna used to say, and that's the truth. Except I can't do it like she used to do it. And I know people here don't even know who she was, Gilda Radner. Okay, so, Katie, Ms.
Yeah, I would hope they'd be a huge part of the discussion and be able to actually bring more information by not being limited.
And Chair Cooper, for whatever it's worth, we support the amendment.
Okay. I know. Yeah, okay. So, all right, we've got a motion and a second on the amendment. Everybody in the favor of the amendment as presented by Representative Hilton, say aye. Aye. Anyone opposed? Okay, the ayes have the amendment, and the amendment will be made. Oh, one opposed. All right, and now we'll go for the bill. Everybody in the favor of the bill? It's not a bill, it's a resolution technically. Getting tired, I'm ready for this 40-day 40 to come. Everyone in favor of the passage of the House bill, Resolution 847 LC 570284, say aye. Aye. Anyone opposed, no? Excuse me, as amended, there we go. Working together, we may get this done. Thank you, committee. Appreciate that. As amended. Okay, I don't know whether we'll have another meeting or not. If we don't, I still believe I have the best committee going. I appreciate everybody coming as often as you can and getting here and help me get a quota. And I hope everybody has a good spring and summer.